Okay. Hey, Sigourney, how are you?
Good.
Good. Okay, so thank you for coming today. Our first session is just going to be about just going over our disclosure statement, kind of introduce introduce myself a little bit, go over your rights, and then we can move forward with what we're going to talk about. Okay. I have to start off by telling you that I am a graduate student and I'm working towards the completion of my master's degree in professional counseling. I'm currently practicing counseling techniques and therefore will be recording our session, but don't worry about it. Only my professor and classmates will see the tape. The recording will be destroyed at the end of the semester. Likewise, you should know that there are some limitations to the counseling. Please note that it is not possible to guarantee any specific results regarding your counseling goals. However, you and I will work together to achieve the best possible results for you. Okay. You have any questions so far about that? No? Okay. Now I just want to go to let you know that you do have rights as a client, and it is your right that at any time to inquire about the process and procedures being used during our counseling relationship, that you have the right to refuse or request changes to any of my suggestions. If at any time you're not satisfied with my services for any reason, you can inform me or my supervisor, Dr. Jennifer Roberts. Once you have begun counseling with me, there are no obligations to continue. You have the right to discontinue at any time, though I ask that you participate in a termination session. Should you desire a referral to another therapist, I will provide you with one. My services are rendered in a professional manner, consistent with the ethics standards of the American Counseling Association. If you have any complaints concerning malpractice, this can also be reported to my supervisor, Dr. Jennifer Roberts. Do you have any questions over the client rights?
No.
And then I also want to include our confidentiality. Just want to let you know that everything that we talk about in the session will be kept confidential, except if I determine that you are an imminent danger to yourself or others, if you report child or elderly abuse or neglect, if your records are subpoenaed by a court of law, if you disclose sexual contact with a mental health provider with whom you've had a professional relationship, if information is requested by your contract provider, HMO insurance company, EAP, if I am directed to you in writing to disclose information to someone of your choosing, or if you bring a malpractice suit against me. You have any questions over that one?
No.
Okay. So just so we can both have an understanding, you can go ahead and sign this, saying that you understand everything that we've discussed.
Put the date.
Okay. Sigourney, you did fill out an assessment and history information, and we're just kind of going to go over that real quick. Let's see. Let's talk about your anxiety. Can you tell me a little bit about that? What's causing this anxiety?
So the couple of times that I've had it, really, it's mostly when I get like really upset. It'll just be like whatever situation comes up, and I just get really worked up and overwhelmed and really upset, and I don't even know if it's actually the official term is an anxiety attack, but that's what I think I have.
And what's going through your head when you're having an anxiety attack? Or what do you think it is?
I think I just really want to get myself out of that situation. At that time, I'm only thinking about how I can help myself and I guess get myself to stop feeling like that.
Okay. And you work out in order to kind of get away from the mindset. Is that right?
Yeah. Try to, I guess, burn some of that energy and I guess transfer that energy into positive energy.
And I see that you have a good relationship with your parents. Is that right?
Mm-hmm.
Can we talk about your grandma for a little bit? Is that something that you're comfortable? Is that something that you feel it's affecting you in your life right now?
Not right now. I do feel like it affected me when it happened, back in college, but I don't think, I mean, I think about it, I think about her all the time, but I don't think it affects me now as much as it used to.
Okay, that's good. And what would you say your goal for coming to the counseling session is? I know you're saying that you're wanting to become more confident, but is there something else that you want to achieve at the end of the counseling sessions?
I guess just confidence and self-esteem.
What do you feel like you need to just be more confident in yourself? Is that something that you feel you lack?
Sometimes I feel like I guess doubt myself a little bit sometimes. I feel like sometimes I'm very confident, but then other times I kind of like lack that confidence a little bit, and I feel like I could have a little bit more of it, I guess.
Okay. Is there something else that the assessment asked that you would want to talk about or want to follow up with, or something that you feel like you just need to get off your chest?
Um, mm, I don't think so.
Okay. Well, since this is our first session and most of our time was being taken up by going over the disclosure statement, I do want to touch base on your anxiety and see if, in this short amount of time that we're going to be together, see if we can help that confidence or boost it and see if we can meet that goal. But again, like disclosure statement said, I can't guarantee you that it'll happen, but we'll try and get there.
Okay.
And let's see. Is there going to be any more questions for me?
I don't think so.
All right. Well, thank you so much for going.
Thank you.